Okay, good morning, good afternoon, good evening po sa lahat. Welcome to our 151st episode of Stop COVID That's webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who've just discovered us for today, welcome po. And for today, we will be going back to a grand rounds type of approach po, no? Something that will make it a little bit more interesting for our webinar today. So as you have seen in our publicity materials, our topic for today, progeria and rehabilitation. So rehabilitation po is a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in their interactions with their environment. And anyone at any point in their lives may need rehabilitation following illness, injury, surgery, or declining function with age. So today, we will be discussing the case of a patient with Hutchinson-Gilford progeria syndrome, an extremely rare progressive genetic disorder that causes children to age rapidly. If you're familiar with the Benjamin Button movie, para po siyang ganoon. And we will then take a closer look at the field of rehabilitation medicine, how important it is for restoring functions, improving the quality of life, and respecting the needs and dignity of individuals who may suffer from untreatable, intractable, or terminal conditions. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Fridays, and always looking forward. Last week, we had her as our main presenter, but today, she is my partner again, our adjunct research faculty at the National Telehealth Center, co-host, and internationally renowned public health communications expert, Dr. Susie Pineda Mercado. Dr. Susie.
Hi, Raymond. Magandang hapon po sa inyong lahat. Good afternoon, everyone. And we'd like to welcome you, all of you who are with us on the live broadcast Zoom webinar, and to all those who are watching via live streaming of TVUP YouTube channel, as well as the UP System Facebook page, TVUP Facebook page, Stop COVID That's Facebook page, and of course, all those who are watching from TVUP Signal TV Channel 101. As mentioned by Raymond, patients with progeria manifest with bone problems, osteoporosis, and heart problems. And the average life expectancy for a child with progeria is about 15 years. Some with this condition may die younger, and others may live longer, even to about 20 years. There's no cure for progeria, but new treatments and research show some promise for managing symptoms and complications. So as Raymond mentioned, we are going to talk about rehabilitation medicine, and we do have outstanding speakers. We bring you only the best speakers we can possibly find, and it is a grand rounds type. But we are focusing on the field of rehabilitation because not everything can be treated or cured. And there are many instances when our doctors need to focus on how do we improve the quality of life of our patients. So the PGH Rehabilitation Medicine team established a program called SIGLA, which helps patients who are bedridden to be able to sit up. Now, one might think, wow, is that an important thing? Actually, it's very important to be able to sit up if all you can do is lie down. So I think improving the quality of life is at the core of the work of our rehab specialists. And we are very fortunate to have as our main speaker and presenter, senior resident in charge of the case of progeria is Dr. Arenby Fiesta. Our other speakers are Dr. Mona Lim Dunca, who is consultant of the Pediatric Rehabilitation Service, and Dr. Shelley Grace E. Fuliante, who is the head of the Sigla Seating Clinic. So it is a clinic where they help patients learn how to sit. Finally, synthesis and closing remarks will be done by none other than PGH Coordinator for Training, Dr. Marie Dion Sakdalan. And as you've seen in our opening billboard, we have transitioned. We started out this webinar series talking about COVID, but now COVID means still COVID. We talk about that, but we also talk about other outbreaks, viruses, infections, disasters. And today we're going to talk about rehabilitation. But before that, we know that you are all quite excited to hear about the news both here and abroad, and it's for this reason that we bring you the news update.
Okay, for our very first news update po, no? The Philippines starts the ban on trans fat in prepackaged processed food products. So, what does that mean? Ito pong polisiyang ito, it's meant to address the high consumption of trans fats. Makikita nyo po 'yon sa mga labeling ng mga sa labas po ng mga packaging, no? Trans fats which increase the risk of developing coronary heart disease and other diseases. This is based on the orders issued by the Department of Health and the Food and Drug Administration in 2021, wherein processed food products containing trans fatty acids are prohibited from being manufactured, imported, and distributed for commercial sale after June 18, 2023. Ang sabi po ng FDA, all product formulations and labels of prepackaged processed food containing trans fat must be fully compliant with their guidelines. Dr. Susie?
Okay, a total of 60 local government units in Region 5, in the Bicol region, will benefit from 722 million worth of community sub-projects on nutrition. So this is the Kapit Bisig Laban sa Kahirapan, Comprehensive and Integrated Delivery of Social Services, or Kalahi CIDSS, of the Department of Social Welfare and Development. This is an ongoing project, and the coverage will include 30 towns of Camarines Sur, 7 towns of Catanduanes, 16 towns in Masbate, and 7 towns in Sorsogon. Some of the nutrition-sensitive intervention projects are the digging of small community wells, maintenance of community water sources, construction of community toilets. Also included are the provision of nutrition learning materials and technical support to integrate nutrition-focused child development activities and minor civil works for daycare centers. So it looks like 360-degree programs for children focused on nutrition and health in the Bicol region. And that's our news for today. We'll be back next week with more news on the news update. Okay, and we are back. So Raymond, we have person on the street or housekeeping mo muna?
We'll do a little bit of housekeeping muna, Dr. Susie. For all those who have been emailing us or reaching out via our Facebook Messenger po, no? We'd like to let you know that if you have completed at least 50% of the webinar duration, you will be eligible to receive the certificates. There are those, for the most part, I think there are those who have been receiving their certificates but they want their full name. So please make sure po kung ano po yung nando po sa registration po nila, yun po yung naka-reflect kasi yun po yung ipupull lang po namin ng mga pangalan in your e-certificates. If you have any questions in particular, please let us know by emailing us at stopcoviddeaths@up.edu.ph. We are still working kasi po it will be jointly issued by the Climate Change Commission, yung pong e-certificates natin from last week. So please keep an eye out. But for webinars 149 and previous to that, we have already completed sending out of our e-certificates. Okay? So before we go into our fun quiz po, no? Well, Dr. Susie already mentioned our person on the street video. And for those who are joining us for the very first time, we'd like to set our discussion into context by watching this very short video produced by TVUP. Ang questions po that we pose to the common folks on the street, ano po ang alam ninyo tungkol sa mga batang may kapansanan na nagre-rehab? May kakilala po ba kayong mga batang nagpa-rehab ng parte ng kanilang katawan at ano ang kanilang ginagawa sa mga rehab sessions? Please watch this.
Actually, meron akong kakilala na mayroong clubfoot.
I personally underwent rehab, physical rehab, kasi dati for 21 years, hindi ko kayang i-pronounce yung letter R. So, actually, ang tawag daw doon, if I remember correctly, is rotacism.
So, meron akong scoliosis. Like, ano siya, yung curve ng scoliosis ko is from right to left, yung curve niya. So, thoracic ata yung tawag dun.
Pagkapanganak niya pa lang, meron na siya nito. So, ang itsura ng clubfoot is usually, di ba, ang paa natin ganito, diretso. Pero yung sa kanya, yung kabila, nakaganyan.
Sabi ng doktor, parang mga 43 degrees na siya. Tapos, need na daw ako for x-ray, for operation. Ayaw ni mami kasi syempre takot siya mag-opera. So, pinasuot nila ako ng brace sa likod.
So dati, pag sinasabi ko yung letter R, ganito ako magsalita. Araw-araw, chicharon, durog-durog, trouble pronouncing certain words, certain letters. So ayun, part din pala ng rehab yun. Part din ng physical rehab yun. Hindi lang pala about accidents, paralysis.
Mahaba yung pinagdaanan na process ng pinsan ko para makorekto. Katulad na lang na pagsusuot ng cast. Nilagyan siya ng cast. I am not sure if sinuutan siya ng brace. Pero nag-cast siya. Halos ilang beses din sila pabalik-balik sa doktor.
So, sinuot ko siya for mga months lang, ganun. Pero hindi ko siya tinuloy kasi parang nahihiya ko. Nasuotin siya sa school kasi bakal talaga siya.
Lumapit ako sa kaibigan ko na speech pathologist. Tapos in-explain niya sa akin na ganito, ganyan. Tapos may mga binigay siya sa aking exercises.
Tapos, yung ginagawa ng PT ko, una muna niyang gagawin is maglalagay siya ng parang kuryente na something sa likod ko para daw lumambot muna yung mga buto-buto.
At hindi lang din isang cast yung nilalagay sa kanya, parang pinapalitan din siya from time to time as the foot is adjusting.
Tapos, after niya gawin yun, i-massage niya yung likod ko dun sa part kung saan siya malaki. Pero inuna niya muna yung kaliwa. Kasi parang hindi ko maintindihan. Pero parang pinag-aralan niya na kailangan gumalaw muna yung kaliwa bago mo mayas yung kanan.
Explanation niya kasi sa akin is, kaya daw hindi ko nasasabi yung letter R ay dahil mali yung positioning ng dila ko. So kailangan ko lang i-relax at i-train yung muscle ng dila ko na pumunta siya sa tamang posisyon para magawa ko yung tamang pagbigkas ng letterang R.
So, habang bata siya, nakasemento yung paa niya ng matagal, and yung development ng paglalakad ay na-delay. Pero, ngayon, sa awa naman ng heavens, okay na yung paglalakad niya, maganda na yung legs niya, at she's a very active kid.
So, sa PT, hindi naman siya like maayos agad. Parang tutulungan lang niyang mag-lesson. I guess it helps. Parang hindi na siya nagmukhang malaki. Nung nag-start ako mag-PT, hindi na mukhang malaki yung likod ko. Hindi na siya halatang hindi pantay yung likod ko. So yun, nag-PT ako kasi ayaw ko i-opera pa ni mami.
After less than a week, parang 4 days, naliligo ako noon. Tapos ginagawa ko lang siya. Tapos first time na nag-vibrate yung letter R ko, gumanon. So naiyak talaga ako noon. So, ang masasuggest ko lang is supportahan natin yung mga nag-rehab. Kahit anong klaseng physical rehab pa yan, simple o sobrang lala, supportahan natin sila dahil malaking bagay ito para sa kanila.
Thank you very much, TVUP. What an excellent person on the street interview. I think we are really fortunate to have the Philippine General Hospital Rehabilitation Team with us. Because, Raymond, we haven't had much chance to. We've had discussions on rehabilitation, but not so much. And I think for the grand rounds today, we'll really see how important it is to support rehabilitation medicine. And I'd like to greet all of our physical therapists and rehab medicine specialists who are with us today. Parang alam ko kulang na kulang tayo ng mga magaling sa rehab. Pero makikita niyo po ngayon yung tindi po ng nagagawa nila para sa mga pasyente natin. Okay, over to you, Raymond.
Thank you, Dr. Susie. And we'd also like to greet those members din po. No? We've also invited members from the Philippine Academy of Rehabilitation Medicine. Thank you so much for joining us. And very thankful also to TVUP that we're able to gain insights po yung sa alam po nila. Meron po sa speech, meron naman po tungkol sa physical therapy. So not not every day, and what we're seeing in the chat din po, how some of you can relate dun po sa person on the street video. Okay, so but before we delve into the webinar, we'd just like to mention that we will be having our standard panel discussion format, and after our speakers have presented, that will be followed by our Q&A session. So if you have any questions already, even before the webinar started, please put them in the Q&A box here in Zoom or in the comment section for Facebook and YouTube. But before we delve into the webinar, we know everyone is excited and looking forward to this cute intro video for our fun quiz segment.
The Little Mermaid daw yan, Raymond.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
That's funny. I think that's funny.
Can we have it on the screen? Our Zoom poll po, tsaka sa slide then. Okay, so for those who are joining us outside of the Zoom, you can still participate in our fun quiz by opening up your web browsers and entering in the address bar, typing in po slido.com. When you are prompted, you enter the code 6510096. That's 6510096 for you to be able to participate in our fun quiz. So for today po, we have 3 questions, as you can see on the screen din po, no? And we'll start off by answering, hopefully you're participate and answer the questions. Question number 1, the following are the signs of progeria after age 2 years old. Letter A, skin aging or wrinkles. Letter B, recurrent joint dislocations. Letter C, early cardiovascular disease. Letter D, early osteoporosis. And letter E, all of the above. Okay? At this point, we'd like to greet those who are joining us. Dito lang po muna sa Pilipinas all the way. There are those from the Philippine Pediatric Society from Bigan City in Ilocos, from Central Philippine University in Pototan, Iloilo, from Valladolid District Hospital in Bacolod City in Western Visayas, from MCU Hospital in Caloocan City, from Angeles University Foundation Medical Center, Angeles City in Pampanga po. There are those who are joining us from all the way from Rizal Medical Center, from Iloilo City, watching from the House of Representatives sa Quezon City po. Maraming salamat. From Bataan, from the province of Bataan, Governor Joet, maraming salamat po. From UPPGH, Outpatient Department Pharmacy, thank you so much. From the Department of Rehab Medicine in PGH, thank you. From Clark, Pampanga, from Giginto, Bulacan, Air Force City Hospital in Mabalacat, Pampanga, LCUP, Malolos, Bulacan. There are from UP Los Baños, from RPHS, Annex 1 in Antipolo City, Rizal, University of Rizal System Health Services. Thank you so much. Loma de Gato, Marilao, Bulacan. From Cavite. So maraming salamat po.
Raymond, teka muna. Hindi daw nila makita yung questions. Kaya sumasagot yung mga mga audience natin sa chat.
O nga, no, kaya 3 pa lang pala yung nandito sa Zoom. Can we can relaunch it again? I'll relaunch the poll. Sana everyone can
Saka hello to Gov Joet, if you're watching, nako, pinakamahusay na governor yan ng Pilipinas. Oo, Gov, kamusta?
Okay, may pahabol din po from the Philippine Heart Center in the perfusion section po. Ayan, rumami na. So I think they're seeing it on the screen.
Gumagalaw na. Oo. Sorry po, mga hindi nakapasok. Go ahead.
What is the Sigla Seating Clinic? Is it letter A, it helps provide a custom chair for patients with poor sitting balance? Letter B, helps provide adequate seating to improve mobility. Letter C, it's applicable for all ages, bata man o matanda. Letter D, all of the above. So as you know, we are also being viewed po internationally. So ito po ang ating mga kababayan, mga avid viewers at tagasunod po internationally from the Thai Hua Kwan Moral Charities in Yunos, Singapore, from Stockton, California in the United States, from the University of the Philippines Nursing Alumni Association International in Edison, New Jersey, from Canadian Medical Center in Dammam, Saudi Arabia, from University of Hail in the Kingdom of Saudi Arabia, from Vinmec International Hospital in Phuoc Cuoc City in Vietnam. Thank you so much. Luigi Alif University of Blida 2, from Larba or Blida, Algeria. Thank you so much. So those who are joining us in USINE School and colleges, who else? Those who are joining us. So we have USA, California. Ayun po. So all the way from California, from Stockton. I think that should be it. So thank you so much, and we hope everyone is able, kahit alam po namin if you're in the East Coast, no? As Dr. Susie is in, medyo it's a bit past midnight. But maraming salamat po that you're joining us for today's webinar. Question number 3. For question number 3, who can benefit from being seen at the Sigla Sitting Clinic? Letter A, stroke patients with poor sitting balance. Letter B, patients with posture control problems. Letter C, patients with spinal deformities and instabilities. Letter D, hydrocephalus patients who cannot lift their heads. Letter E, all of the above. So we'll not be closing po muna itong fun quiz po namin, and I hope everyone will be able to join as we move on to our webinar proper. Dr. Susie?
Okay, I know you're all excited to get this discussion on. So let me introduce our very first speaker. And as I said, we bring you only the best. We have the senior resident in charge of this case from the Philippine General Hospital Department of Rehabilitation Medicine. Please welcome Dr. Arenby Fiesta. Dr. Arenby, welcome to the webinar.
Good morning po. Good morning to everyone who's watching.
Yeah, go ahead. Doctora, go ahead.
I'll be sharing po my slide na ma'am.
Yes, please.
So, good morning everyone. I am Dr. Marie Arenby Carelianes Fiesta, and I present to you this case entitled PROGERIA Batang Matanda sa Rehab Ano ang Ating Magagawa. Progeria is a rare genetic disease that is caused by a sporadically occurring gene mutation coding for the protein lamin A. There are only about 16 Filipino patients documented with this disease, and patients appear to have a faster rate of aging than most kids their age. The most common cause of mortality for progeria is cardiovascular in nature, and most of them die during the second decade of life. This image shows the classic characteristics of patients with progeria, and you'll see the similarities or the presence of this characteristics in the patient that we will be presenting later. So even though patients with progeria appear to age faster, there are only some aspects of normal aging that it shares. These are frailty, sarcopenia, osteoporosis, vision loss, increased cardiovascular events, skin and subcutaneous events. So for now, I present you the case of patient DA, a 15-year-old female right-handed grade 9 student, second of 4 children, Catholic with a baseline functional capacity of bedbound, maximally assisted immobilization, toileting, dressing, grooming, and bathing. Her chief complaint is severe hip pain. At birth, the patient was noted to have thin skin, prominent scalp veins, and skin looking like that of an old person. She was very slow to gain weight, and the patient was brought to several doctors by her patients. The patient was eventually referred to a geneticist, and she was suspected to have progeria. She was referred to the Progeria Research Foundation. At age of 3, the patient was started on the medication lonafarnib, which up to now she takes daily. Patient then lived a relatively normal childhood and was active in school and extracurricular activities. 4 years prior to admission, the patient started having recurrent dislocation of her shoulders and hip. The last being on the year of 2021, with the left hip being dislocated, and the doctors were not able to relocate anymore the hip to the socket. 1 year prior to admission, The patient spontaneously dislocated her contralateral hip during an unrelated surgery. She was allegedly seen by an orthopedic doctor, but no interventions were done. And due to the COVID-19 pandemic, was lost to follow up, and definitive management for her hip was not achieved. Since then, the patient has been bedridden and was eventually brought to PGH at 6 months prior to admission, where a multidisciplinary team was set up. According to the multidisciplinary team, the patient was not a good candidate anymore for surgery due to her poor cardiovascular status and bone health. Pain management was then prioritized and the anesthesiology service was tapped. She was then referred to rehab medicine to improve her range of motion, strength, and improve her mobility. These are the images of the patient during her infancy. For the review of systems of this patient, as you can see, she has difficulty in heat regulation, failure to gain weight, she has dizziness on head movement, she does not have dyspnea or orthopnea or chest pains, and has no history of loss of consciousness. However, there was noted multiple deformities of her digits of hands and feet. It was also important to note that the patient had unremarkable family history. Her developmental history was generally at par with her age, and she had good coping with regards to her disease and has no significant psychosocial issues. The functional independence measure of this patient was 63, which meant that the patient had level 3 moderate assistance in all her activities of daily living. Focusing now on the physical examination of the patient, she was noted to be severely underweight with severe thinness. For the general systemic examination of this patient, she has absent scalp and facial hair. She has prominent blood vessels, prominent eyeballs, small face, frontal bossing, beak nose, thin lips, crowded teeth with micrognathia, and a high-pitched voice. She also has prominent ribs and costochondral joints. Her heart examination was generally unremarkable. For her abdomen, it was globular with taut and shiny skin with a well-coaptated midline incision scar. For the musculoskeletal examination of the patient, she was noted to have generalized muscle atrophy with very thin skin, dystrophic nails, and multiple flexion contractures of the digits. There was also noted webbing and glowing of the digits of the bilateral hands and feet and prominent bilateral elbows and knee joints. Neurologically, the cognitive status of this patient is normal, and the only pertinent finding is a fast beating nystagmus for this patient. For the muscle testing of this patient, there was generalized weakness of the upper and lower extremities. For the lower extremity, it was mostly limited due to the pain. She has normal sensory testing and intact deep tendon reflexes. Range of motion testing for this patient showed significant limitations in the ranges of motion of the bilateral shoulders, the bilateral hips, the bilateral knees and ankles of this patient. We requested several imaging for this patient, and we noted that the patient had an enlarged calvarium with a very small face, small mid-face, and a small jaw. And also her dentition or her teeth were very crowded. Assessment of the chest of the patient showed prominent pulmonary vessels, an enlarged heart, rib notching, with noted erosive changes of the superior surface of the right rib. There was also noted lysis of the bilateral distal clavicles of this patient and decreased bone mineralization. X-rays of the spine also reveal a straightening of the spine with loss of its natural curvatures. Focusing on the pelvis of the patient, we note that there is decreased cortical lining and thinned out walls of the pelvis. It also shows a very shallow acetabulum with a formation of a pseudo-hip joint, wherein the head of the femur is dislodged into the bilateral iliac wings of the patient. As you can see in the next image, there is noted evident coxa valga of up to almost 180 degrees of angulation. There is also decreased cortical margins of the bilateral femur. The distal metaphysis and epiphysis of the femur show distal expansion or trumpeting. Again, there is also evidence of decreased mineralization and cortical outlines for the bones of the patient. Given all these findings, the final diagnosis for this patient was Hutchinson-Gilford progeria syndrome, chronic dislocation of the bilateral hip, chronic nociceptive pain, carotid artery disease with dyslipidemia, severe acute malnutrition, to consider obstructive pulmonary or obstructive lung disease mild, and BPPV. Listed also below are the multiple dislocations of the patient and the history of Tabisol last 2021. Given the medical problems of the patient, here are the rehabilitation problems that we have encountered for the patient in terms of alterations in body function and structure, activity limitations, participation limitations, environmental, and personal and social issues. In rehab, we have determined several goals for the patient. For the short-term goals, it was mainly to improve pain control, improve her range of motion, achieve a seated position for this patient, improve her exercise endurance and strength, and provide the patient with a seating device, a wheelchair, and an adaptive device for her to do her ADLs. In the end, we want to achieve the maximal function or optimize the function of the patient despite the complications of her disease. So we initiated bedside physical therapy for this patient, focusing on range of motion, improvement in strength, improvement in mobility, and improvement in the tolerance of an upright sitting position. Here are the videos of a patient during her occupational therapy session. We decided to focus on her activities of daily living and provide her with an adaptive device. As you can see here, she's using a reacher in order to do lower body dressing. And in occupational therapy also, we targeted the development of a seating device for the patient, again, to achieve upright positioning. For psychology, we assessed the patient for body image issues, depression, anxiety, and we initiated motivational counseling for this patient. Listed here are the considerations for a seating device for the patient. And as you can see, there are several considerations. So for the first one, it should be able to be used to other seats or chairs to accommodate the patient. It should be soft and should conform to the patient's body, should be easy to assemble or disassemble, should be easy to clean and breathable, and finally, not too restrictive. For the wheelchair considerations for the patient, there's a lot more to consider. So first of all, it should be an electric type reclining wheelchair because of the decreased endurance of this patient. It should have a headrest. It should have a soft seat or back cushioning. Seat should be angulated to prevent falls, should have removable armrests, raised footrests, posteriorly positioned axles, and heavy-duty all-terrain wheels. Finally, the wheelchair should have a high battery life and is easy to repair and maintain. Despite the plans of an appropriate wheelchair for the patient, we were not able to acquire a powered wheelchair during this admission. She was instead given a standard manual pediatric wheelchair that needed several modifications due to her decreased capacity of upright seating. The patient was then enrolled to the seating device clinic of the Department of Rehabilitation Medicine called SIGLA, or Sitting Initiatives to Gain Lasting Abilities. The initial sitting device of the patient was fabricated. However, it brought about issues in comfort. First of all, it was quite restrictive, it is bulky, it was too hot, and it was difficult to maintain. A second round of seating modification was done, and somehow it was able to improve the comfort of the patient and improve her mobility. During her follow-up, it was evident that the patient had better seating angulation. Her wheelchair and seating devices allowed her to participate in online schooling, which she was unable to do prior. She was now also able to mobilize herself, minimally assisted, and do independent propulsion of her wheelchair at home. In the end, rehabilitation was able to give the patient the highest attainable function despite several limitations imposed to her by her disease. and rehabilitation was able to restore some of the most important activities that encourage independence in our patient. Thank you very much for your time and your listening.
Wow, thank you so much, Dr. Fiesta, for presenting this case. Truly very, very interesting and amazing work that you're doing at rehab at the Philippine General Hospital, and you will see, you'll see the appreciation of our audience. Of course, I'm sure there are questions, but it's just really so amazing how you have patiently tried to find a solution. I was so touched by seeing the little girl on a computer trying to study. So, this is very, very important in our work in health. Maraming salamat po. Yeah. Raymond, over to you.
Thank you, Dr. R&B. So for those who were able to prepare their questions naman po, no? And something that we often encourage, if you have any questions already, please put them in the Q&A box po, and we'll be choosing the upvoted questions. We're also seeing that there are those who have started to typing in their questions po in the comment section for Stop COVID Deaths or TVUP Facebook pages or TVUP YouTube channel. So welcome po iyon, and we hope we'll be able to capture those questions and ask them to our speakers. Our next speaker, she's also from the PGH Department of Rehab Medicine, consultant on the Pediatric Rehabilitation Service. Please give a virtual welcome to Dr. Mona Lisa Lim Dungka. Dr. Mona.
Hi, good afternoon po to everybody. I would just want to react to the case that was presented, which is not quite the typical pediatric rehab case, but essentially will show you the principles that we'd like to follow. So in many instances, we're faced with children with permanent disabilities or impairments, and really it's a holistic approach to trying to maximize function. It's not just a matter of adding years to life, but it's really quality years to life. And the concern really is that even if we can't cure or make things normal, we really can strive to make things better. And so the point of rehabilitation really is, as was shown earlier, maybe to redefine what we need to probably concentrate on as priorities of what the patient aims to achieve depending on the condition. So really, when we talk of pediatric rehabilitation, progeria is just one. It's a whole gamut. We'd like to cater and improve the quality of life of children with special needs. And sometimes cure is not necessarily achievable, but definitely making it better for the child is something that we can strive for. So I think if I may share my slide, if I may.
Go ahead.
Yes, please. Thank you. So
Let's wait, Mona. Yan na.
yes, there you
Go
are.
to slideshow. Yeah, there you go.
Okay. So maybe just to make it a little bit more easy to remember, what we'd like to do in terms of rehabilitation, particularly for the child. It's a little bit more tricky for kids. It's not to say that the adult is not difficult to do rehab for, but in children, we must consider that these children still should be growing and developing. And so we'd like to intervene early. So we'd like to think that each child that we deal with, we will go on an epic journey with them. And epic is, we want to intervene early. We want to make sure that the assessment is properly done. And so it's not just a matter of diagnosis. We want to identify the comorbidities. And so in rehab, sometimes it's beyond the diagnosis. We'd like to see the problems that the illness provides in terms of activity limitation and functional impairments. And that's the reason why the functional assessment is really part of the management. And because we're dealing with different children of different age groups, really the intervention is individualized. So part of it is really figuring out what is appropriate at this point in time, which might not be the same when the patient is already a teenager as compared to when she was a toddler. But every time, it is always oriented towards function. And the priority of function is dependent on what the family and what the children or the child deems most important. And so in this case, we really need to be collaborative, no? Not just with the medical specialists, but we also need to be collaborative with our paramedical specialists and most importantly with the patient and the family. In dealing with children, sometimes we also need to ask them. Sometimes it's overlooked, but actually it's very important to also ask the child what is most important at this point in time, not just because of the developmental stage, but also really in terms of priorities. And this we do with whatever diagnosis the patient has. So I hope we were able to illustrate that in our case. So let me stop sharing. Yeah. So and hopefully to give you an idea as to how we can help patients that you refer to us, no, uh, for rehabilitation. So in our particular case, we were very lucky. No? It really takes a village to raise a child, much more so a child with special needs. And we're very lucky in PGH that we have the whole gamut of medical specialties. We had to do multiple multidisciplinary conferences for planning for this patient. And we're also very lucky in the department to have all the paramedical specialties, our PTs, OTs, speech, and even our psychologists, as well as orthotists and prosthetists, to help in the treatment of the child. No? And so one of the things that we'd like to focus on is really maximizing function in certain cases with certain adaptive equipment. And I think this was what was shown in our patient's case, not just in terms of the seating, but also for self-care. So hopefully we can partner with you for patients that you feel may benefit from our services, no? Because it truly is an epic journey with each child. So thank you so much.
Thank you so much. That's Dr. Mona Dongka, who is consultant of the PGH Pediatric Rehabilitation Service, and for lending your insights beyond the sort of like the case presentation, but I think a more holistic view of what we try to achieve in rehabilitation medicine. Okay, our last speaker for today is the head of the Sigla Seating Clinic. And we'd like to welcome to our screens Dr. Shelly Fuliante. Shelly, welcome.
Hello, good afternoon, everyone. Thank you for inviting us again. Wow. So I'm here po to react po on Dr. R&B's management on the wheelchair devices. So let me share my screen po muna and then.
Go ahead po.
Okay. Ayan, okay. So, are my slides clear po?
Yes po, go ahead.
Go
Okay.
ahead.
So, I'm here to discuss the wheelchair and the seating device used for Dr. R&B's patient. But first of all, I would like to thank Dr. R&B, Dr. Ramona for guiding the team po no, in managing this case. It's actually very we're very lucky not to see one of these cases. As Dr. R&B said, it is a very rare case, and at least we had the chance to manage one. And ang pinaka-important na part here in this case report was it's not only the case itself, but what rehabilitation medicine can do. As Dr. Ramona said earlier, it's more of maximizing the function of the patient. And unfortunately, when nagkaroon ng hip concern ng ating patient, she wasn't allowed na to stand, and then she was having difficulty in sitting upright. So one of the management na advice or given to her was to provide her a wheelchair and seating device. It was emphasized earlier that the management should be individualized. So it's not just a typical way of prescribing a wheelchair, standard wheelchair. Before, what we used to do there was before, what we used to do there was we just provide sa for wheelchair lang po kayo, standard, just reclining, minsan doon na nag-end and then bahala na yung patient, no? But in one of our trainings sa wheelchair deliveries, no, sa wheelchair prescription, uh, it's not enough na nagbigay ka, okay? Dapat iisipin mo rin how comfortable yung patient mo dun sa binigay mong device, no? Because I've seen cases na even if we have provided a wheelchair and even if we, di ba marami pong donation ng wheelchair, even if we have provided it, they tend not to use it kasi hindi pala siya comfortable for the patient. Or for example, we did not even consider the environmental and home condition of our patient. Hindi pala kasya sa loob ng bahay, there's no proper storage, ng ganyan. So, kumbaga, yung ang ating programa na sigla, okay, it's very holistic approach, individualized approach on how to help our patients na mas magamit at ma-maximize ang function even if they are on a wheelchair or in a sitting device. Okay, so I just want to, before I move on to Sigla program, I just want to give my reaction lang po to Dr. R&D's presentation. So in this slide, no, the patient here is sent to us in a stroller. I think this is the first time that Dr. R&D saw the patient. Okay, it's a typical scenario at the OPD, especially in our patients po na bedridden. Okay, they are sent here to the clinic, and then usually either stroller po yan or in a stretcher, okay, because walang other means to bring them there, no, hindi naman po natin sila mapapalakad. So for in this case, for pediatric patients, modified stroller or a bigger type of stroller. But look at the patient, kung titingnan ho natin sila, kung titingnan natin siya, it's very uncomfortable just by looking at the knee, okay? Kung saan po nakalapat ng kanyang knee, mahaba po, no? This type of stroller po is made for babies, and ito po yung kanyang footrest, okay? It was parang extended already, pero the length of her thigh, no, is not enough. Kumbaga, it's too long for that. So kumbaga nakalapat po dito. Try to imagine for sitting like that for a very long time and then nakadanggal po ang legs, there's no support, mangangalay at mangangalay po siya. Okay, and this one also, it's also reclined. This is not the usual sitting position natin, no, but of course we should also consider the comfort of her, we should consider her comfort. Maybe this is her most comfortable angle at that point, and then look at the armrest. Okay, so wala po siya talagang adequate armrest. So these are the things, no, na kailangan nating i-address. And if kasi if we allow them to use this kind of wheelchair, this kind of stroller for a very long time, they're very prone to have complications like bed sores, okay? They can still have pressure ulcers, okay? And then contractures. Yeah. So even if the patient is in a wheelchair or in a stroller, okay, they also have the same complications. They're also at risk of complications in prolonged immobility. So even if they're on a wheelchair, yun gusto rin natin yun i-avoid. Okay, so Dr. R&D said earlier that they referred her to physical therapy not only to strengthening and range of motion exercises, but also to improve the sitting tolerance of the patient, no, because when she initially saw the patient cannot tolerate upright sitting. Very important na if you want to prescribe a wheelchair, it's very important to know kung ano yung kayang iupo ng ating mga pasyente, no? For example, if the patient is more comfortable in a semi-seated position, okay, then maybe we might need to consider prescribing a reclining type of wheelchair. Obviously, standard type of wheelchair, hindi na po pwedeng gawin yon. If minsan naman, if yun lang ang available, we try to refer them to physical therapy and try to improve their tolerance to upright sitting. So, the sigla, no, is not only for sitting, but we have to assess the patient kung ano pa po yung kayang gawin ng patient to improve the tolerance in sitting. Next is we referred them to occupational therapy for the sitting device, no? Modified seating device. So in this one naman po, we usually refer them to avoid the complications. Kasi most of the time in our wheelchairs po, no, they have the standard sizes. Even if we say, no, we measured the pelvis, we measured the length, we measured the height of the patient. Sometimes, minsan maliliit talaga po yung patient. No? It's not fit. Okay, so we need these modified seating devices para po maka-avoid po na para mas maging komportable sila. Comfort is very important on this one. When we use this modified seating device, the pelvis po is positioned in a more comfortable position, and then the legs, no, are well supported. At the same time, the spine, remember in Dr. R&B's report, di ba, yung patient po straightened yung spine, so it will really require a lot of support there. So pwede nating i-modify po yung likod po to support the spine of the patient, because if pangit po ang support sa likod, they can have scoliosis. So it's actually one of the common complications if poor po yung sitting position ng ating pasyente. So these are the things po na we ask our OTs to do, sinusukat po sila, and then para po maging fit to prevent these kind of complications. So in Dr. R&B slide, there were considerations. I do agree on the considerations for the seating device. We should also consider yung seating device po should be flexible enough na pwede rin po siyang sa mga ibang seat po sa loob ng bahay, no? Para maging practical lang po tayo, pwede po kasing yung seating device can be something na detachable from the wheelchair, and you can actually use it inside the house. Pwede nyo pong i-attach sa chair so they can use it also inside. Okay, kasi sometimes a wheelchair naman po doesn't fit inside. Remember, sa typical houses in the Philippines, hindi naman po lahat maluluwag, no, na pwede hong magkasya yung wheelchair. So what we can do there is the seating device that we modified for our patient. It's something that is detachable sa wheelchair and pwede rin natin hong gamitin sa loob. Okay, so for the patient's comfort. Okay, for the wheelchair, agree that electric type reclining pediatric wheelchair is ideal for her because maganda po yung kanyang cognitive function and yung kanyang upper extremity strength. And then the rest po, no, the soft back and seat cushioning is also important to prevent pressure ulcers. So these are the things that I agree on. However, because remember, ang electric wheelchair is also expensive, na po, and the more modification, parang kotse, habang pinadagdag nyo po yung additional style, pamahal din ho siya ng pamahal. So the typical scenario in PGH, if the patient cannot afford to buy the ideal wheelchair, is we try to modify kung ano po ang meron. No? So these are basically the standard pediatric wheelchair that we have. That is basically, these are readily available, they're according to size, but look at this patient po, no, dun sa standard wheelchair, kahit po yan na po yung pinakamaliit namin na pinakamalapit sa size po niya, it's still wide enough, wala pong masyadong support sa kanyang knees, wala rin pong masyadong, hindi po abot yung kanyang paa sa footrest and the leg rest. Therefore, this patient is referred to us, to OTs, for the modified seating device. Okay, so yun po ang nagiging rule ng SIGLA program, ng Sitting Initiatives to Gain Lasting Abilities. So once the patient is sent to us for evaluation, we again reassess. We consider a lot of things, the home environment, ano po yung ginagamit pang biyahe papuntang hospital. No, these are very important po because sometimes we forget, no, nag-isip lang tayo ng wheelchair pero nakalimutan natin ano yung mode of transportation, ano yung sa loob ng bahay niya, no? So these are the things na kino-consider rin po ng SIGLA program. Okay, so I'll move on to the patient, and just to explain lang po, no, the initial seating device, this is a simple Uratex foam po. Okay, and It is measured by our OTs, and obviously, as Dr. R&D said earlier, it's too bulky, mainit. So pag ganito po yung itsura ng ating seating device, anong tendency? Hindi po gagamitin. The patient will prefer, no, sa kama na lang siya. So to avoid those kinds of scenario na kaysa sa mas piliin niya ang kama kaysa sa wheelchair, no, we try to modify, look for additional different material na mas malamig for the patient and mas magiging komportable po siya. So, pwede naman pong less bulkier. Mas importante po kasi yung pelvis positioning, no, at saka po yung sa paa. Because dapat po maganda po ang suporta sa paa. Kasi mas nagkukos po siya ng knee pain. Remember, our patient is having a lot of joint pains, no? So, gusto natin. So, well-supported po ang lahat ng joints. Look at the armrest mo ngayon, okay? Maganda na po yung height ng kanyang seat. Abot na po sa shoulder, sa elbow ng patient natin. Look at the length of the seat here. Okay? And then meron na po tayong footrest. So relax po yung tuhod at saka legs ng ating pasyente. So it's very important then proper measurement, ano po yung talagang need ng ating patient. So this is a good example po on how the seating device can improve the function of our patient. This patient po is lucky enough na maluwag po yung kanyang bahay na pwedeng mapasok yung wheelchair, no? But in some of our patients, we just try to get this part of the seating device, and then linalagay na lang din po sa upuan nila sa loob so they can function inside their house. So, ayan. Okay. So, if you have patient, just a reminder lang po, if you have a patient with a poor sitting tolerance, this is Sigla caters to all, not only to pediatric patients. We can also cater stroke patients with poor sitting tolerance. Everyone who are kunyari pa na bedridden na, who are having a difficulty in standing, okay, you may refer your patients to us. Okay, so if you want to refer your patient for a sitting device, you may set an appointment at UPPGH Outpatient Clinic, okay, using this link. Okay, and then after that, pag nagkaroon na po na tayo ng appointment, please choose rehabilitation medicine. Wala po doon yung sigla. Ang hahanapin niyo po doon ay rehabilitation medicine, and then we will do an assessment by a duty team po ng OPD by a physiatrist, and then if there's a need to refer to a sitting clinic team, the sitting clinic team will again assess the patient, then we will do planning of wheelchair and sitting devices. After the planning, we'll do measurement and fabrication, check out, and then delivery of the device. Okay, so these are applicable to all ages, to all conditions, who will be needing or who will be who have a poor sitting tolerance, and basically po that's it, no? So if ever, no, we try to lessen the stigma lang po na pagka kayo po ay bedridden, wala na hong magagawa, no? I think ang rehab people po are here to help para po mas ma-maximize po yung function, no? As Dr. Mona said earlier, it's not only adding years to life, but it's more of adding life to years. So thank you very much po, and I hope you learned something from our services po. Salamat.
Oh, thank you so much, Dr. Shelley. What a wonderful reflection and insight, Raymond, no?
I really like the parang the bespoke customization ng sa chair. I didn't realize it, but when I was looking at, parang nakalutang lang yung legs niya dun sa pinakamaliit na chair, and now it's well supported. Thank you so much, Dr. Shelley, especially for the pictures that you've shared po. So at this point, we'll ask Dr. R&B and Dr. Ramona to open up their videos. And while they're doing that, we'll take a very quick break for a special public service announcement for today.
O sige na, anak. Parang kagat lang ng langgam. Kantik o yung kumikiliti lang? Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayoko po ng red hunting. Masakit kumagat at takot rin po ako sa blood. Magtutugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Colorin yan for love.
Thank you, Doc. Thank you, Nay.
Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Eh, mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Okay, thank you so much, TVUP, the COVID Communication Public Service Announcement. Just one of the many creative outputs of the Stop COVID That's team to push for vaccination for children age 5 and above. Please share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, let's time to entertain some questions. Dr. Susie.
Okay, so let's get the ball rolling. No, I was gonna ask all of our speakers. I've seen in the community the children with any kind of disability. Minsan, talagang nasa bahay lang sila and they don't know where to go. So I was very happy that Shelly shared how to contact PGH Rehab, no? But you're in Manila, and a lot of these cases, well, not necessarily progeria, but any kind of disability of a child. Talagang parang what should I say? There is maybe stigma, maybe there's a lack of information. So what I want to ask you is, how do you approach health workers on the ground and health centers and families so that children who have conditions that cannot really be treated but require rehabilitation, how can they be brought out? Paano silang mabibigyan ng tulong? So let's start with sino bang magandang mag-start? Dr. Fiesta, go ahead.
Hello po, good afternoon po. For us, rehab medicine po, right now, we still offer po our telehealth services for those who are in far-flung areas po. So since PGH is in Manila, most of our patients are being catered po yung nearby areas lang. For farther away patients po, no, they can still contact us through the links that was presented by Dr. Poliante. And then we can guide them through our teleconsults regarding po yung mga possible management for the patients. If they can't come po, meron naman din po kasing iba-ibang rehabilitation specialists near their areas. We can help them locate rehabilitation specialists, especially po yung ibang mga areas na akala nila wala, pero meron naman po palang mga rehab doctors near their areas. In terms of being able to teach our mga grassroots na mga physicians or for example mga healthcare workers, our rehab team has a community-based rehab project po. We bring to the communities po wheelchairs, assistive devices, even po mga prostheses for patients po na nangangailangan po. Hindi nga lang po ganun kadalas kasi syempre po we have issues with mga supply, but we do give training po and then free consultations for these patients po. Right now, it's really hard po, honestly, kasi kami pong rehab doctors pa lang, konti na. So, we try our best po to provide linkages for our patients po. So if our patients are far-flung areas po, yun po, we can give telehealth consults for them and then guide them. And then sometimes we can go to their areas po and collect patients and see them for free and give advices po regarding assistive devices po and prosthetics and orthotics for the patients po.
Doc Mona, what are your thoughts on this? I mean, I would think there are really a lot of kids out there who have some kind of a condition. And it's good to hear that telehealth is available. But you've also mentioned, Doctora also mentioned yung yung kulang ng human resources with the expertise and the training. I mean, we have barangay health workers, I think, everywhere. What are your thoughts on this? How do we give every child an opportunity? Because one of the messages I got out of this case was every child is valuable and important, diba? So what are your thoughts on this? How do we solve this on a larger scale?
That is really a problem. No, access. It's not just access, physical access, but really access to the medical specialist or paramedical specialist. So I think number one po, so Dr. R&B already mentioned the initiatives, not just of PGH, but among a lot of other rehabilitation centers for actually trying to bridge that through community-based initiatives. And this is training in the barangay health workers. But I think the group po, or maybe the unit that we should never underestimate is the family of the child. Really, the goal of rehabilitation, so if you notice, the epic journey is collaborative. And the most important member of that collaborative journey is really the family, because they're the ones who will institute. If we're going to teach them, if we're going to do tele, or if we're going to just have them give us feedback, we need to collaborate with the family and also see their needs, because really they're the best partners. We might lose the nurses, the therapists, but the family will always be there. And if the lessons have been imbibed and maybe they get the principles, sometimes you would be so surprised po, ma'am, that the family is actually the one who can come up with such creative solutions, because it's really geared towards the situation that they have. Now, given that, so that's at the grassroots level, and yes, we do have barangay health workers. I think even our paramedicals also immerse themselves, this is the therapists, also immerse themselves in their own services for community-based rehabilitation. And it's not just a matter of orthotics and prosthetics, it's just assessment. So I think what we need to also redefine po is that when we do have children with special needs, like what you said, is to come up front and try to see what services we can do to maximize the potential. Yeah, like what you said, there are still areas where these children are hidden from view, whether they are thought of as lucky or a disgrace to the family. But I think that's changing now. And what we just need to do is to give all these patients and their families the opportunity, maybe, and the information for them to access. But I think one of the most important thing po is really trying to capitalize on how the family can actually help, because they're the ones there 24/7.
Yeah, thank you for that, Mona. Shelly, on your end, let me rephrase this a little bit. No, maybe families are embarrassed, okay, or they don't know what to do. But how about also, I have seen on the ground that they want to protect these kids because there's stigma, and other children can be cruel and can, manukso, magbigay ng mga pangalan. How can we change that? Shelly, ikaw.
Usually, ma'am, no, part of the community service kasi is not only yung pagbibigay ng health, parang health needs ng ating patient, it's more on the education also. So, kumbaga, we try, as part of it kasi is we educate people, not only limited to barangay health workers, but it's actually a community education, no? We invite different families. Remember doing the community programs whenever we go there, we invite, yung mga kapitbahay din. Okay? Simply because we want to educate parang on how to approach yung yung kalagayan din nung kasama nila na may kapansanan. It's very important po kasi to increase the awareness. Siguro po we also have to understand na as doctors, as rehab specialists, no, we're not dealing, actually yung patient, okay lang po yung pedya Kumbaga yung bata, they're okay. Ang talagang pasyente po natin, yung mommy, primary caregiver, is actually they're the ones we have to educate. No, kasi kumbaga yung lalo na pagkabata pa yung patient, kumbaga they don't know that what's wrong with them. Kumbaga hindi naman sila aware doon pag bata pa sila. Nag-e-evolve po, just like Dr. Ramona said, nag-e-evolve siya as biglang naging teenager na, no, as they become more aware. And I think habang nandun pa po tayo sa stage na wala pa masyadong effect yung sa bata yung kanyang disability, I think education coming from the community po, no, we have to, kumbaga siguro po part of it yung LGU training, yung ating hindi lang po sa barangay, baka at least municipality level po talaga yung awareness, yung education, because lalo na if kunyari po, di ba, may census ng mga children with disability, if na pick up po na meron po doon sa town na yon, I think it should be part of the program already, para at least they know how to deal they know how to deal with them pag nakita nila yung bata in a wheelchair, di ba? Or yung bata na may severe scoliosis or with autistic disorder, they know how to handle them as well, no? Hindi yung, kasi we remember kung hindi rin po kasi marunong mag-handle yung community, iba rin po yung approach ng treatment. So siguro municipality level, as soon as they pick up that there's someone has disability or there's a children with disability, baka po mas maganda naturuan na rin po agad yung hindi lang po yung family yung tinuturuan, dapat po atay the whole community will be living with them. Yes.
Yeah, thank you. Na si Raymond, si
Sorry.
Dr. Radwin. Oh, go ahead. Who is
Sorry,
that?
if I may add, maybe another thing that would, I just maybe another thing that we can take a look at is actually inclusivity in the public school setting. I think the aim now, especially for education, is really to integrate children, especially children who have a little bit more functionality, in terms of exposing their normal counterparts, so that it becomes really part of inclusivity or acceptance, no, of children with various disabilities. So maybe that's another way, as what you had said, to raise awareness and maybe to learn how to deal with children with special needs as part of normal society. No?
Thank you so much, Mona. So it's the empathy, no? Si Dr. Godwin put here. Sometimes it takes only one act of kindness and caring to change a person's life. Si Jackie Chan daw nagsabi. Minsan maganda itong mga comments ni Dr. Godwin. But truly, I mean, this is about our values as human beings, no? Over and beyond what we do as professionals. Okay, Raymond, we've got questions in the Q&A box. Over to you.
Yes, ito po. I'll ask Dr. Shelly. Kasi I saw at least two other questions. But very similar to what Fatima Brillantes asked. So, for new graduates na PT, are there opportunities to volunteer at PGH, at Rehab, or specifically at the Sigla Sitting Clinic? Meron daw po ba?
So, may reports na kayo.
Pwede po, pwede. But so far po kasi, hindi po specific to Sigla. I think the volunteer program, ma'am, no, if you may correct me, Ma'am Mona, but I think the volunteer program is really for the physical therapy department po talaga. Parang it's not only at the Sigla unit, but I think it's more on the mobility clinic po ata sila napupunta. So, but ano po, no, they can still encounter these patients kasi kumbaga isa lang naman po ang area ng physical therapy, and they're welcome naman po to join the ano po, the sigla program if they have time po, no, kunyari after their patient, pwede po silang dumaan doon to ask questions about the sigla program. Opo. But for now, to answer the question, wala pa kung specific for sigla, wala pa po.
Sa Monday daw magsa-start na si Doc Sherry.
Next question,
Gawin natin po.
very related naman po. Not volunteering, but can advocates, especially this one come from Ms. Lauren Reyes, in the community-based programs or projects relative to assistive technologies, can advocates collaborate with the Department of Rehab Medicine for customized design? Baka pwede nyo po magamit sa sitting clinic, that sort of thing. Dr. Ramona?
Yes po, collaboration is always good. It's part of the epic journey. We probably would just need to find out lang po, like if you want to work with us for a specific patient or if this is going to be something a little bit more formal. But yes, collaboration, we are all for it. And suggestions, we do like to get feedback. If you notice po, our patient was actually network. No, we're doing the therapy in her locality, so we do network. We think that it's best to network with other like-minded professionals to make the delivery of services a little bit more accessible. So yes po, thank you so much for that suggestion.
Okay, questions, Dr. Susie?
Yeah, I have one here from my phone which says, kasama ba ito sa universal healthcare? Does PhilHealth cover any of the assistive devices? So anyone can answer.
Dr. Shelley?
Okay, for the PhilHealth po, so far wheelchair is not part of the coverage po. But in the CWD po, okay, ang covered na po ay prosthesis, orthosis, okay? It's actually most, tama po Doc, no, orthosis and prosthesis, but the wheelchair po, hindi pa po siya part ng ating coverage po sa PhilHealth. Yeah. So mga ankle foot orthosis, braces, for scoliosis, yes, it's part of the PhilHealth coverage na po for CWD mobility.
Okay.
Dr.
Actually,
for the PROGERIA patient and
sorry,
mamon.
yeah.
Sige po.
Sorry. For the CWD package, so for mobility, there are actually several. For the mobility package, that's the orthotic devices po. So wheelchair is not included. However, there is a children with disabilities packages po for developmental. There is one for hearing impairment. And there is one also for visual. So it really depends kung ano po yung main problem ng bata. And there are certain rehabilitation and therapeutic services attached to each of these packages. However, the packages are available, I think, only on certain hospitals that have been accredited for these packages.
Okay. So for that progeria patient po, yung kung ano, what was covered for the patient by PhilHealth? I mean, aside from yung pong for assistive technology, that part of it. Meron po ba?
Unfortunately po, sir, wala po na-cover for this patient from the PhilHealth po. Hindi po siya covered ng any packages for PhilHealth, sir.
Okay. Kasi I mean,
sad, parang
kasi obviously there would be like other customizations for other patients. If PhilHealth will not cover them, medyo will rely on donors and talagang goodness of hearts, ganyan, that type of thing.
Pero sila talaga yung mga nangangailangan, di ba? Tsaka chronic, this is like chronic progressive yung dito sa case nung progeria, no? So anyway, you have any more questions there, Raymond? Let's go to the You want to go to the fun quiz already, or you still have some questions there?
Well, there's one, pero sige, we'll ask na lang to from Rose and Dakigan.
Sige, go ahead.
Those with speech problems po, no nasa video, kanina spots, with difficulty pronouncing the letter R, are they considered PWD as a communication disability? Yun po ang kanyang katanungan. Dr. Mona, sige ma'am.
Siguro it depends on the level of the severity of the communication disorder. But if the patient is intelligible enough, even if the pronunciation is a little bit off the norm, but if he can get his message through without much difficulty, I don't think we can really qualify him as having a disability, because when you say there's a disability, there is a problem doing that specific activity in the society. And if the patient is still able to communicate with relatively good intelligibility, parang mahirap po yun.
Okay, thank you. Dr. Susie, I don't think
Yeah,
we have...
I have a question here again on my text. No, there was a mention of a registry for children with disability. I'm not sure who mentioned that. Maybe it's Dr. Shelley. Would you like to expound on that? I mean, do we actually know where these children are? I think the context of this question is, if private organizations or individuals want to help, how would they know where these children are?
Actually, ma'am, I think the discussed po na registry was for the progeria patients. But I think yung so far I'm not really sure po if there's really like a standardized nationwide registry for children with disability. Wala pa po ata, ma'am. Opo. So ang parang it's more of a for a specific condition. Tama po, Dr. Ramona. For example, for cerebral palsy patients, they have their own registry because of their own kumbaga meron lang po silang sariling community. I think yun po, parang per condition, ma'am, ang meron, ma'am. But so far, nationwide registry for all kinds of disability in children, wala pa po. Yeah. Opo.
Okay.
Yeah.
So, Raymond, puntahan na natin yung
We can
fun
go
quiz.
with the fun quiz,
Okay.
Dr. Susie. Let me just, okay. Okay, there we go. For the question number 1, so I'll ask each of you po. So Dr. R&B for question number 1. The following are the signs of progeria after the age of 2. What's the correct answer po?
The correct answer po, sir, is letter E, all of the above po.
All of the above. Okay, so skin aging and wrinkles for our audience po, recurrent joint of dislocations, early CV disease, and early osteoporosis. Number 2, for Dr. Mona, what is the sigla seating clinic?
D, all of the above, as
Above.
mentioned by Dr. Shelley.
Ayan po. So it helps provide a custom chair for patients with poor sitting balance, helps provide adequate seating to improve mobility, and for all ages, hindi lang po siya pangbata. Okay? And then question number 3 is for Dr. Fuliante, who can benefit from being seen at the Sigla Seating Clinic.
And the answer is E, all of the above din po.
All of the above. Okay, so we have stroke patients with poor balance po pag nakaupo, patients with posture control problems, patients with spinal deformities and instabilities, and hydrocephalus patients who cannot lift their heads. So maraming salamat po. And for our audience, hope you're able to remember po after our webinar these answers. And if you have any more questions, please feel free to put them in as we move on po to our panel evaluation poll. So for our panel evaluation poll, it's 5 questions, if a 4-point Likert scale. And while I'm reading the questions, I would like to ask each of our 3 speakers to come up with their 1 minute or so final takeaway message for our audience. If there's anything from the webinar that you'd like the audience to take away, sana po yun po ang inyong message sa kanila. So I'll read the questions right now. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we won't be closing this panel discussion poll or evaluation poll until the end of the webinar as we move on to the final messages from our speakers. Dr. Susie.
Okay, thank you so much, Raymond. We are going into our parting words, and we're going to start with Dr. Shelly Grace Fulante. Shelly, please go ahead.
Okay, to all our audience po, just remember lang po that all patients po, regardless of their condition, their lahat po ng complaint nila, these are complaints na kahit sabihin natin na medyo parang alanganin or we don't feel like it's really important. For them, it's important. We should learn how to listen. Okay, listen to their needs, and even to children, connection, okay, for us to understand them better is very important. And then siguro po proper assessment, okay, we try to listen, basta listen and connection to our patients is very important. Lahat po yan, kahit feeling natin maarte lang po or it's still a complaint na something that we have to address. So, yun lang po, connection and be more, lang po sa kanilang needs. Yan, thank you.
Thank you so much. That's Dr. Shelly Fulante. Let's go to Dr. Mona Dunca. Mona, go ahead.
Maybe just to make it easier to remember po, when we talk of the pediatric rehab patients, it's still the epic journey, early intervention. We want to do proper assessment, whether it is a medical or paramedical service. We want to do individualized intervention po, and we want to be able to be collaborative with all medical and family members as well as paramedical staff, even the community. And we really need to constantly monitor these patients because they're growing. Because the whole point of rehab po is we may not be able to cure, but we aim to make it better so that we can add quality to life. Thank you.
Thank you so much. Last but not least, and congratulations for a great presentation. We have Dr. R&B Fiesta who did our grand rounds case. Go ahead, Dr. R&B.
I will share po my learning from taking care of this patient po. No? So, for us, first of all, sa aming doctors po, we should see beyond the patient as a disease. And we should see the patients as a family member, as a community member, as a student, as a friend. We should learn po yung kanilang dynamics so that we are able to restore them, if not to the previous function, yun pong highest ability or most empowered state that they can be. And then for those who are not rehab doctors or mga allied medical professionals po or other people who are concerned with people with disability, be open po for meron tayong hindi nakikita na capabilities of our patients. Sometimes we put them in a box na ganito lang yung kaya nila. Sometimes we put them in parang restricted na activities or hindi na nila kaya to, hindi na nila pwedeng ma-achieve yan. So as much as possible, as a family member, as a friend, or as a doctor, non-rehab doctor, we should be able to open our minds to different possibilities for our patient and allow them to achieve the best that they can po. Yun po. Thank you very much po.
Thank you so much. It's Dr. R&B Fiesta. Natouch naman ako. Parang naiyak naman ako doon sa sinabi ni Doktora. But I can feel the heartfelt commitment that you have to this particular patient and to your other patients. Thank you so much for sharing this with us. Okay, Raymond, do we want to go to the panel evaluation poll results first?
Okay, so far, can we have it on the screen? So far, we have 65% of the attendees in the Zoom responding to it, and at least 91% of them have indicated that they strongly agree with all of the statements, which means it's also a testament to how well received the topic is and also the insights that they've gained from our speaker. So thank you. So on behalf of the webinar team, maraming salamat po to the PGH Department of Rehabilitation Medicine. Dr. Susie.
Thank you so much, Raymond. Let's go to our brief synthesis and closing remarks We have the coordinator for training of the Philippine General Hospital, Dr. Marie Dion Sakdalan. Dion, go ahead.
Good afternoon. Can you hear me?
Yes.
Yes, hello. Good afternoon. Marami pong salamat, Dr. Susie and Dr. Raymond. We are now concluding our 151st episode entitled PROGERIA, Batang Matanda. Sa Rehab, ano ang ating magagawa? So we had a very informative presentation of our specialists from the Department of Rehab Medicine. We were presented a case by Dr. R&B Fiesta, who provided or presented a case of a rare condition called Hutchinson-Gilford progeria syndrome, which is a genetic disease which causes faster rate of aging. And these patients would actually die early, around the second decade of life, due to cardiovascular complications and other complications related to their illness. So she presented this case of a 15-year-old female who went to them, consulted them for hip pain, and this is one of the complications of her illness. Aside from that, she had other problems like frailty, sarcopenia, there was malnutrition, osteoporosis, and you can see the very nice pictures provided by our presenter. So Dr. Fiesta showed how the PGH rehabilitation services spearheaded the management of our young patient, not really to cure the disease, but more to improve pain control and range of function or range of motion, improve the strength, the mobility, and the tolerance of the patient in a sitting position, optimize her function despite the complications of her illness, and maximize their function with or without or with the assistive device that they were recommending her to use. Aside from the musculoskeletal issues, with the rehab services also initiated addressing the psychosocial issues that were with the patient. No? This included body image issues, motivational issues, and these were all addressed by the team. What's very unique to this approach that the rehab doctors gave our patient is improving the seating and the capacity of the patient to tolerate seating position. And this they did together with the SIGLA program of the rehab department. So Dr. Shelly Poliante, who's our second reactor, who's the head of the seating clinic, presented or described the management that they do in this clinic. So in the sitting clinic, they try not just to prescribe the seating device, but they also try to assess the comfort and how the patients comply with the use of the seating device to improve the patient's tolerance to the seating position. So the SIGLA is an acronym to the term sitting initiatives to gain lasting abilities. So they don't just cater to pediatric patients, they also cater to stroke patients, those who are bedridden with chronic illness, to allow them better seating tolerance so they can improve their function and their quality of life. So for our index patient, they did serial adjustments on the seating on the wheelchair so that they would be able to improve the seating capacity and allow better mobilization of the patient. They also tried to restore maximum possible independence and quality of life through this program. So in SIGLA, they do assessment, they refer to the seating clinic, and then they plan, they measure, and then they fabricate the device, and they can even offer delivery to their homes. No? So with the SIGLA, they collaborate with other members of the paramedical professionals of the rehab department. So they consult the physical therapist to improve the strength and function of the patient. And then they also refer to the occupational therapist to better fit the adaptive device to the patient's needs, including how she will use it, how they can transport from one place to the next, and others. Finally, our first reactor, Dr. Mona Lisa Dunca, a consultant of the Pediatric Rehabilitation Service of the Department of Rehab Medicine, talked about children with disability and impairment. So she mentioned that when cure is not anymore the realistic goal, the goal of rehab is to adjust, to allow the patients to have additional quality years of life based on their goals and their priority in terms of function. So She actually earlier she mentioned about the principles of rehab or pediatric rehab, which can be easily remembered by the acronym EPIC, EPICC, which means early intervention, proper assessment, individualized intervention, collaboration, and this was mentioned during the discussion, collaboration not just with the healthcare team, but also with the family members and even with the community. And the last C means constant monitoring. So the rehab services of the Philippine General Hospital not just only provide service in the hospital, they also have a format or a format for teleconsultation. So they can provide these consultations to our patients in the far-flung areas. And I think they also have community-based initiatives so that they can bring this service to our patients in the community. So later on in the discussion, we talked about access to these specialized care, the consideration in terms of inclusivity, particularly for patients who don't have enough funds to be able to access these special service. And of course, we also talked about empowering the family and the community to help these patients with special needs. So we had this case initially presented by Dr. Aaron B., a patient with progeria. And this case was just a springboard to discuss how rehab medicine can improve function and quality of life on patients with chronic diseases. So this afternoon, we realized that with rehab, marami pang magagawa. Every human being is indeed valuable, even for patients with chronic illnesses, already bedridden, and not just for children with special needs. When cure is not the goal anymore, but more of improvement of independence and quality of life, we can consult a set of specialized doctors and paramedical professionals who can address these unique goals of our patients. So with that, thank you po for attending our webinar this afternoon.
Okay, thank you so much. Teka, walang video ko. Thank you so much, Dion. Ang ganda naman ng closing remarks mo. So that's Marie Dion Sakdalan, Coordinator for Training of the Philippine General Hospital. Thank you so much, Dion. I really appreciated that. Okay, so next week, we will have the Department of Dermatology. And we don't have the specific topic yet, Raymond, no? But you're going to get the best speakers, I'm very sure. So be with us next week. We're going to talk about dermatology. Raymond, over to you.
Okay, thank you so much. And thank you again. I'd like to reiterate our deep appreciation to the PGH Department of Rehabilitation Medicine for making sure that we have an interesting topic to discuss for today. Sana po marami po kayo natutunan. And also thank you to the PGH Coordinator for Training, Dr. Dion Sakdalan, for that wonderful and succinct po na synthesis and closing remarks. Before we formally close our program for the week, we'd like to invite everyone to view those yung mga naka-archive po sa TVUP YouTube channel. So if you go to www.youtube.com/TVUPPH, you'll be able to see all 150 webinars to date. After today, maging 151 na po siya. Nandun din po yung live streaming link, as well as yung pang tinatawag po namin yung mga selected na presentations that we feature in its entirety. Konti lang po siya, very, very short and consumable. SCD shorts ang tawag po namin sa kanila. Also found at the youtube.com/TVUPPH channel of the TVUP. So yan po, sana po you'll have the time to be able to watch them again dun po sa ating YouTube channel. So this formally closes our webinar for the week. Magkita-kita po tayo again next week and then same time sa ating Friday po from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.